Joining us today. I'm Tessa from Walters Clover. I'm the sales manager for South Africa. And with me on the call is Doreen, my colleague. She's the customer success specialist or manager, and she will be doing the training and onboarding with you today for Uptodate. Yeah, so I'm just going to hand over to Doreen.
Thank you, Tessa. Welcome, everyone. As Tessa already introduced us, we are very excited to show you this wonderful tool that we think will bring benefit to your clinical workflow and also enhance better clinical practice. During this session, I'll be doing a combination of slides and then going back to the tool in order to show you as much as possible within the hour that we have booked. Please do feel free to ask any questions during this session. And if the question can wait, put it in the chat and we can follow up on those questions as well. Without any further ado, I would like to share my screen. If someone can confirm, host disable antennas, okay. Let's see if I will be able to share. It says host disable attender screen sharing. Could you please give me access to share my screen?
One moment.
Yes.
Go ahead and try sharing.
Okay, let me try again. Yes, fantastic. Thank you. Okay. I'll say share. You should all be able to see my screen now, correct?
Yes.
Fantastic. Thank you. Okay. So we have a trial set up for the Kingsbury Hospital for the coming month, starting as of the 3rd of June, which is next week, Monday. It's a trial period of a month. We'll highly recommend and encourage you to use this month to use as many possible the tool during practice. Any feedback related to the tool, always reach out to Tessa or to me, and we can follow up on those questions as well. If there are any access issues, connect with IT and then get back to us. We'll be more than happy to assist on those as well. During the month, we'll be having like a check-in moments to just check if everything is going on well with the trial access. So in this session, I'll be walking you through a few slides, and then we'll be going to the tool itself, and I'll be using some clinical scenarios to just highlight the few features that are available in the tool. So what is up to date? I'll conduct a normal, but also a more advanced search. Also showing and highlighting the drug information, as we have a lot of information on drug-related disease concern, but also dosage adjustment, adverse reactions, and so on. What are the new updates in Uptodate and all related practice-changing updates in Uptodate? I hope you're all familiar with Uptodate. If not, I have this slide with a lot of numbers on it, but I think this is a great way to just highlight the impact Uptodate can have and how it's structured for all physicians and pharmacists and everyone that is practicing healthcare in order to have the appropriate information in order to transfer this information to the patient. So what is Uptodate? Uptodate is an electronic evidence-based physician-authored clinical decision support resource that you can use at the point of care, meaning it's written by clinicians for clinicians to use when they are in need of additional information or when there is uncertainty. You have the option to be able to find the appropriate treatment path or drug to that condition. So in Uptodate, we have over 12,000 topics segmented over 25 specialties almost every topic has a graded recommendation, meaning that the literature that was used has been graded based on the level of evidence found in those studies in that literature and put into an actionable recommendation. As I mentioned earlier on, we work with a very large team of expert contributors, as we call them. These are people that are still clinically active, affiliated with university institution, but also at the core of healthcare. So they know what they are writing about. They see patients and they are involved and engaged with all the aspects that are related to the condition that they are writing about. And you can find this information when you are in the topic. We also have medical staff on staff as well, and it has been proven or been shown in more than 100 individual studies that Uptodate improve patient care in general. Uptodate is being used over 2 million clinicians globally. So that also says something about the impact of the tool and how powerful the tool is. The information is being pulled from over 400 medical world-renowned journals, whereby we create a summary of all the literatures that are available to make a sensible topic out of it. Also in Uptodate, because it's a prescribing tool or CDS support, we also have the drugs incorporated in the topic so that you'll be able to find the appropriate drug for the specific condition you are looking into. We also have the Continuing Medical Education Board also accrediting and also recognize Uptodate as an education tool to use at the point of care. We have additional tools in there. One of them is the medical calculator. So let's say you want to do conversions, but also calculate the Apgar score, for example, or do drug dosing adjustment, then you have the option to use those calculators to do the calculation, and it will classify it for you. As I've mentioned, Uptodate is being used throughout the whole medical team care, whereby we have the physicians, pharmacists, residents, nurses, medical students, and also lab technicians using this tool in order to find the appropriate information. Uptodate is being used across the whole healthcare process, which add to the clinical experience, but also enhance the clinical workflow and also come to a better patient outcome in general. So how does the content come together in Uptodate? And I want to take a moment to just highlight this because I think this makes Uptodate very powerful. So when there is a need for a clinical topic, let's say, for example, when COVID started, we didn't have that much information regarding the disease in general, but also the vaccinations, how frequent you need to vaccinate, what are the clinical presentation, the symptoms, how to follow up on those patients. So what Uptodate did was they pulled from all the clinical resource that they have, which is over 400 journals that we have, pull all the studies that are available and start writing about it. And this was allocated to a team of authors. And these are the expert groups that I mentioned in the previous slide, which has the specialty of infectious diseases. And they started reading these clinical studies and making sense out of it, also grading the information. So when they wrote about it, it was handed over to the peer reviewers. And what the peer reviewers does is that they are the specialists within the specialty that the topic is being written in. So let's say we are speaking of COVID, then this will be infection diseases specialists that will be peer reviewing the topic. When this process is done, it will be handed over to the grading working group. And what the grading working group does is that they take all the literature and then grade them based on the level of evidence found in those literature. So was it a systematic review, randomized controlled trial, or opinion study? Depending on which of those type of study it was, they will classify it and try to give an actionable recommendation. Let's say we have a study that is based on an opinion. It doesn't mean that it is a bad study. It only says that it's based on opinion of someone, and it can be done over a longer period of time, but still doable to use at the point of care. When the grading working group review the literature, they'll add the grading to it, and then the final content will be published, will be sent out, and then this will be published in Uptodate. It doesn't stop there, because every month for every topic, all the literature that was used will be reviewed. If there are any changes, then the topic will get an update, or the section that needed an update will be updated on Uptodate. And I'll be showing you where you can find those information as well. So before starting the trial, we have set the trial up that you need to register, because this will help us also get more usage information in order to give feedback on how it has been used during the trial. By registering, it also allows you to do a few things. It allows you access elsewhere. You can accumulate, continue medical education, but also download the mobile app. It also gives you the option to personalize your homepage by adding bookmarks to certain topics, but also go back to your previous viewed topic in Uptodate. When you log on Uptodate by using the URL as highlighted here on the top left, I'll be putting it in the chat as well for later purposes. It will bring you to the main page, allowing you to use the register feature here on the top right, which is orange. When you click on that, it will open the registration form. Please try to fill as much as possible in this registration form. And then you need to create a username and a password, and then a verification code will be sent to that email address. So please use the email address you frequently use. It can be that it will end up in your spam box, so check that one as well, because the verification code is valid for a short period of time. So make sure you do that on time. And after doing that, you are able to use your username and password and log on to Uptodate. And by doing so, it will open the Uptodate homepage as I'm demoing now in the screenshot version for you to start conducting the search. I'll now like to go to Uptodate itself and then show you how it looks like. I think you can all still see my screen. Please confirm by saying yes.
Yes.
Fantastic. Let me give it a few seconds to check if everyone is on board, if there are any questions so far. Is this clear? Great, then we'll be moving on. So when you create your account and you are in Uptodate, it will bring you to this page, allowing you to view everything that is in Uptodate. On the top right hand, you see your name with your account details. You can also change the language settings interface to be able to search in other languages. We have 16 available languages to select from. So make sure you put it in that setting. By changing the interface, it will allow you to only search in that language. The content always remains in English. So in the blue bar, we have a few features in there that will allow you to immediately start going into those features. One of them is the drug interaction features, the calculators. But on the content here on the top left-hand side, we have additional hidden features for you to look into, and I'll be going into them shortly. In the middle, we have the main search bar, allowing you to search on condition, diseases, symptoms, drug, and even lab results. The personalization features are highlighted here below, whereby you can go back to your history up to 3 months back. The 10 most viewed topics will be listed here, and you can bookmark topics that you are interested in. So whenever those topics get an update, you get notified. And the notification is not pushed out by email, but on your personal page, whereby you see, I hope, yes, we can see it here. You see next to the topic that there is an orange dot next to it. That means that the topic has had an update. And there is another way to view this information as well. So what you normally do is that you just go into the search bar and then put in your question, and the system will generate relevant topics that are related to your search term. For today, I'll be using multiple scenarios to just navigate through the system, to just highlight where you can find all features and how those features looks like, and how you can interpret this information from within the feature. So let's say we have a patient with pulmonary embolism and we want to find treatment and follow-up information. We can just start typing in, let me just go to the search. I hope if someone is having issues with viewing the screen, please interrupt me so that I'll reshare my screen and we can continue. So whenever you start searching, the system has a predictive typing, predicting what you are trying to search. In this case, I have just put in a few letters and the system is already suggesting a relevant topic. You also have the option to put in the most frequently used recognized medical abbreviation in the search terms as well. So it makes the search even easier. I'll just select the pulmonary embolism, for example, and it will bring me to the results page as we are viewing right now. On the left-hand side, we'll see all the related topics related to pulmonary embolism. And on the right-hand side, if there are any related pathways, which allows you to go even deeper into the search, will be highlighted on the right-hand side. We can also collapse the results to just see the results topics as I'm doing right now, but I'll recommend to leave it in the expanded version because it always allows you to go to the topic outline to see what are the sections that will be covered within those topics. From here, before I jump into the topic, we can also use under the blue bar, we have like this filtering features that will also allow you to filter your result or narrow down your results by filtering in on just adult-related information, pediatric, patient-related information. We have information related to the topics that educate the patients, and also graphics that are related to the topic that we are looking into. For now, I'll put it on adults filter to just get the information for the adult population. And I'll select the first one to go through the topic and show you how the content looks like. So when we open the topic, we will see the topic title. So in this case, we want to find treatment, prognosis, and follow-up for this acute pulmonary embolism in adults. On the left-hand side, we can see the outline here, as you can see, and I'll be showing you, highlighting a few segments in there. If there are any related graphics, and this can be algorithm, tables, anatomical images, video materials explaining the condition, this will be all listed in the graphics here. Going to the outline, on the right-hand side, we can see the who contributed to the topic, so which physicians and from which institution they are affiliated with. The last time the topic had a literature update, as I mentioned during the introduction, the topic are being reviewed, or the literature used for the topics are being reviewed monthly. If there are any updates or changes, then the changes will be added and the date will be added to the topic, as you can see I'm highlighting. And this also it saves time, because as a physician using this tool, you don't have to think whether this is an all review or wherever. It's transparent. If there are any updates, this will be highlighted as you can see here. You can just see by clicking on read more, it will show you the section that has had an update written in a very short paragraph, also linked back to the original topic as we are viewing right now. As a busy physician, you don't always have the time to read through the full content. As you can see, it's quite rich and detailed information. You can then use the summary and recommendation feature here on the left-hand side, and I'll click on it, and it will automatically bring you to the summary of the full content so that you can easily grab the information and continue with wherever you are doing. So how is the summary and recommendation structured? It will give you a general overview of what the condition is about and what medication or steps needs to be followed. And it's written in bullets so that you can easily grab this information and continue with wherever you are doing. So in this case, the initial treatment or recommendation is being highlighted. If there are any additional or concerning informations will be highlighted in the following up bullets. When we select, for example, the first section, so the initial management or the initial approach with suspected pulmonary embolism, to focus upon stabilizing the patient while clinicians evaluate and define the definitive diagnostic testing in ongoing and so on. And we can also find the additional information, and I'll highlight one of the graphics guiding you through which steps to take. We can scroll down through those information as well. If there are any drugs or any treatment options available, this will be highlighted as well. In this case, they recommend saline, normal saline in stabilizing the patient. But if we go into more advanced treatment, this will also be highlighted. From here, we also can see that there has been some gradings highlighted in here, as you can see. And the grading are always consist of two components, a number and a letter. Number indicating the strength of the recommendation, and letter indicating the quality of the evidence, making it an actionable recommendation. So when we go to the second bullet, for example, for patients with moderate risk of bleeding, blah, 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 we can also see that is graded as 1C. 1C is a strong recommendation. We can click on it, it will open the recommendation explaining, I'm sorry for this pop-up. Why is this? Yeah, it's gone. So we can read more about the recommendation, which is a strong recommendation. However, some of the key evidence supporting the recommendation is in a low quality and so on. Note that whether it's a strong or a weak recommendation, it still gives you transparency in following up on the patient and treating the patient. For now, I'll be using the outline to highlight a few things within the content, allowing you to see what the recommendations are in approaching the patient, but also if there are any prevention precautions that need to be taken, this will be highlighted as well. One of the information which is quite interesting is also the society guidelines that are being used regarding the treatment recommendation, which will be highlighted, as you can see here from within the outline. By clicking on them, it will open the society guidelines that was used. And normally we follow the World Health Organization society guidelines. If it's needed to segment them by regional guidelines, this will be highlighted as well. Also, for every topic, if there are any related patient information, this will be highlighted as well from within the outline. We have two ways of providing the patient-related information. One is the basic information and the other one is the beyond basic information. Basic information basically answer the 5 most frequently asked questions by the patient. And I will just click on it to just show it to you how it looks like. We have it in 3 languages available. We have video materials included in those. And this can be information that can be used when explaining the condition to the patient, but this can also typically be used by the nurses in educating the patient before discharging the patient. Going back to the main page, beyond basic information is more advanced, more up-to-date content, like goes deeper into the content in explaining the condition. Going back to the main sections, also all the references that were used for the specific topic will be highlighted in the references and you can read more. If there are any related topics to this treatment recommendation that is being done, this will be highlighted in the treatment related topics, excuse me for that. And you can go ahead and click on them because they are all hyperlinked to review at the point of care. In this case, there are calculators that needs to be used during the assessment of the prognosis and treatment. And in order to follow up, this will also be highlighted. When you click on them, it will open the calculator for you, and then you can select the appropriate section and it will automatically calculate it, but also classified it for you in order to use this information. The reference will be linked in those calculators as well. I'll be going back to the main screen in order to use another example to highlight another section or another feature that we have in Uptodate. One of them is, for example, let's say there is a drug recommended. You can either go into the drug, or you can search for a drug in Uptodate. So let's say we have a patient which has had a bacterial infection. One of them is, for example, which is a rare disease, but we all know that it has to do with malnutrition, vitamin shortage, and so on. So I'm going to use this scenario to also highlight other features that are in Uptodate that you can also use at the point of care. When I select NOMA, for example, which is luckily we don't see this that often anymore, but once in a while you might be confronted with this kind of infections, which mostly people come to the hospital in a late phase of this infection. You need to be able to treat this patient accordingly to make sure the patients that not deteriorated, the infection does not get worse or maybe get into a septic shock. So when we select NOMA, for example, I'll just select the generic one and I click on all results. We can see all the related topic regarding this. When I open the topic, and you can also see that it's written in the same order as the previous topic. So there is structure in the topic, but also consistency in the way we present the information, so that when you're at the point of care or facing a patient and you just want to double check, you have the same structure, so you don't have to figure out where to find the information. Any questions so far? No, I thought I heard someone. So also the same structure, the contributors, the literature review, and the updated information. On the left-hand side, we can also go back to the summary and recommendation, the introduction of the topics. If there are any microbiology information which is relevant, will be added to the information, the clinical manifestation, pathogenetics, also the differential diagnosis. As we especially with skin conditions, is easily to misdiagnose or to assume or mistreat the patient. So you need to be able to find your different gel diagnosis in order to prescribe the right medication. And it's not always topical medication that is required. Sometimes you need to go deeper by using medication through the IV in order to reduce the infection rate in the body. Also, the treatment options that are available in this case, we need to prescribe antibiotics, how to treat the wound. If there are any surgical repairs that is required, this will be highlighted in there. And another great feature, depending on the condition, how to prevent this condition, the prevention precautions are included, and also the reference are in there. From here, I'll be jumping to the summary and recommendation to give you a different summary and recommendation based on the condition that we are looking into, so that you have the variations that are available. So also here written in a bullet point in order to find the treatment recommendation. If we go to treatment, antibiotics are recommended. And when we find the antibiotics, which are amoxicillin or metronidazole, which is recommended, we can also see the duration also highlighted in here. Also the graded recommendation. If there are any prevention information, this will be highlighted as well. So with this scenario, we have a dedicated drug that we can use. We can either use penicillin or amoxicillin with or without the metronidazole addition to the penicillin. And we know that this metronidazole has some side effects, but also have some effect on the kidney and liver impairment. So we'd like to read more about this information, and this information can be read or viewed by the person who is prescribing the drug, but also this information is so detailed that the person preparing the drug, in this case this will be a pharmacist, might need to look into other information as well. When I select the drug from here, we can then select the type of drug we want to use. In this case, I'll use the systemic information, which will allow us to review the drug monograph as I'm opening right now. Is everyone still able to see my screen? Let me just check. Can someone confirm, please?
Yes, I see your screen.
Oh, fantastic. Thank you. So when we go into the drug information, as I'm highlighting from within the summary and recommendation, it will bring us to the drug monograph, and we can also see that it's quite detailed information. How the drug information is structured is that when we go into dosing, for example, the dosing is structured on population, indication, routes of intake, strength of intake, and duration. So this drug is being prescribed for a bacterial infection, which presented on the skin, but also is in the whole system. So it's not like a topical infection. We need to treat this from within the body. So when there are any alerts, this will be highlighted in here. We also have the option to integrate your hospital formulary in this system. So whenever there is a drug recommended, it will pull the information from within your hospital formulary and add the missing information from within Uptodate for you to be able to have the complete overview of the drug. From the outline, we can look into the dosing as we can see the different population, either the adult or pediatric population. If there are any adverse reactions, contraindications and warning, how to prepare the drug, administer the drug, the FDA approved way of usage, but also the off-label way of usage, because sometimes some drugs can be used for multiple conditions. Also, the safety information are included. We also have the option to do the drug that is recommended, to do our interactions with the existing drug list of that patient. And I'll be doing that shortly after I've shown you the outline. If the person that is going to use this drug is pregnant or breastfeeding, this information are included. The dietary consideration and the monitoring parameters are included. We also know that the pharmacogenomics of patients are more and more relevant as we are going into how do you say, for example, tumor targeting treatment or personalized medicine. You need to have the pharmacogenomics information in order to start a certain treatment, especially when those treatments has severe side effects. So know that this information are included. When we go into the dosing, and I'll select the adult population, for example, it will jump to the section adult population dosing. And from here, we can then select the indication that we are going to prescribe this medication for, which is a soft tissue infection. So when I select that one, we can easily see the drug information, but also how to administer this drug, the strength and the duration and the frequency of that drug. If it's a surgical site infection, for example, also the same strength of dosing, but then the frequency or the time gaps will be 8 hours in this case. For example, if you are going to use this for an abscess indication, we can also see this. As you can see that the strength has changed in this case. From here, we also have the alternated kidney impairment information. Depending on the route of intake will be highlighted. If there are any other conditions that are need to be taken into consideration, this will be highlighted. Also, the creatinine clearance information are included so that you'll not miss anything. When we go to the empathic information, we can also see the various class that needs to be taken into consideration. Depending on the route of intake will be highlighted in those drug information. Adverse reactions is a very relevant sections because we have like reoccurrent adverse reactions, but we also have like contraindications that we need to be aware of. So if there are any frequent adverse reactions, this will be highlighted. Depend on the type of symptoms that will occur, will be highlighted in those informations. Warning and precautions is also very relevant information as we are more and more patient-centric focus. In order, something will work for one patient but might not work for the other patients. So make sure that you know or have access to this evidence-based information within the tool. One of them is concerned related to adverse effects, but also disease-related concern are included in this information. How to prepare the drug, the dosage form, the generic equivalent, all those information are available. And then the labeled way of indications also listed alphabetically for you to view at the point of care. Also, the reproductive monitoring consideration we need to take into account, as we know that as a pregnant lady, you might pass it on to the baby. How do you warn or monitor this kind of drug administration or drug intake in order to jump in when there are any adverse effects during the drug intake? Also, the dietary considerations are included in those information as well. And the section I would like to highlight, which is a great section in my opinion, when prescribing a drug to a patient is that you want to check if the existing drug list of that patient might interact with the prescribed drug. Where we have the drug interaction tool built in Uptodate, you can view this for every drug that we have in the tool, as I'm highlighting right now. When we go to that section, it will allow us to go to the drug interaction program, but we also have a separate feature on the blue bar that you can automatically go into the drug interaction feature. From here, it will give you a static list of the possible interactions with a certain drug or food items, which is great because sometimes it's not just a drug to drug interactions. It can also be a drug to food item of a component of that food. For example, vitamin K in certain food might have some interactions with certain drugs. So how you normally view this is that you launch the program by clicking on drug interactions. And for the time sake, I have already added a few drugs in here. I'll leave this for now. I have added a few drugs in these sections, also adding some food items in here. And when you add the drugs to the system, you can then say analyze. When you select analyze, it will analyze based on the literatures that we have in Uptodate and present you with a list of combination. And it's basically a traffic light mechanism, allowing you to just see in colors what is dangerous and what you don't need to pay too much attention to. In this case, I have added a few drugs that I think are representable. Let's say we are selecting a certain drug for hypertension, for example, and we know that the patient is already using other hypertension medication, but the patient is also has diabetes, for example. And we know that the patient consumes certain food items. We can add those information in there. And by adding the 6 combination, it has presented us with 9 results, as we can see here, whereby the most severe combination will be listed on the top and the less severe it gets will be listed below. We can see that metformin and alcohol needs to be avoided, but also warfarin and Alteplase also needs to be avoided. So why does this 2 combination needs to be avoided? I'll be highlighting those shortly. But we can also see that warfarin and ibuprofen needs to be modified. Why is this needed? So when I select the second one, for example, and I'll be opening it so that you can see the summary of this information, it will give us the combination, what we need to do, and then a very short summary with the severity of the combination, how to manage the patient and also treat the follow-up information. If there are any additional information, this will be highlighted in there. But also, if there are any discussions based on the literature used, this will be summarized for you with the full list of all the literature that was used for that specific drug. When we are in the drug information and we just want to view a single drug interaction, I'll clear this list. For example, I'll say cholera vaccine, for example. We want to know what type of drugs interact with cholera vaccine, for example. I'll say select. Sorry, Wayne, is there any question? Okay. Okay, then we'll follow up. We have some 10 more minutes, so I would like to highlight a few things in addition to the information. So when we select cholera vaccine, for example, it has now presented us with 27 results with multiple combinations that needs to be avoided in general. Also do exact the same thing. It will give you a very nice short summary explaining the severeness, the combination, how to manage the patient, also the types of vaccine that are available, and the discussions based on the literature used for those information. I'll be going back to the main page and highlighting another feature in Uptodate. So I have shown you the drug interaction from within the drug by using the launch program, but you can also use it directly from here and then conduct your drug interaction search. So when we are in Uptodate, we also have, and I saw a very nice article about SSI on your page, an overview and evaluation of surgical site information. Know that we have this information in Uptodate as well. I'll select this on adult population, or let's say pediatric population. Also following up on a repair of abdominal wall hernia, for example. What are the type of information in there, but also the additional information or the graphics that are related to this surgical repair we are looking into. So know that we have a lot of information in Uptodate, and I think this will be complementary to the ones you already have on your page, you have reviewed already. Know that you can also use this information for accreditation purposes. So when you're accrediting the hospital or for quality purposes, you can also use the information from within Uptodate as well. Another great example I want to highlight is the choice of, let's say, hypertension. When I select a hypertension, for example, we can also view this in the same order. And let's say we want to select a basic therapy for hypertension, which is a chronic disease nowadays among the adult population. When I select the information, I'll go exactly the same way as you can see here by selecting the summary and recommendation. It will give you the initial drug therapy, but also when to initiate either a mono drug of a combination drug, also highlighting step by step the drug information that is required. The grading are also included, as you can see, depending on the type of condition and the information found in those literature, that will indicate the grading. So sometimes we have a 1A recommendation, sometimes we have a 2C recommendation. Both of them gives very clear transparency in where the information is being pulled from. Either you can use it for all patients without any hesitation, or you need to take some precaution in order to follow up on those information. In this case, when we are dealing with hypertension, if we are selecting initial treatments, if there are any additional diseases that we need to take into consideration, let's say it's cardiovascular diseases or endocrine related information that we need, these are all highlighted in the outline. From now on, I'll be highlighting other features in Uptodate. So I'll be using the blue arrow, the blue bar in highlighting a few features in them. One of them, if you recall, with the first example I gave about the pulmonary embolism, there was a calculator recommended, but we have over 200 medical calculators embedded in Uptodate for you to use at the point of care. You can use them by clicking on the calculators, as I'm doing right here from the blue bar, allowing you to view them by specialty, as I'm doing so, or selecting the calculator in general. So let's say we want to find a calculator for a stroke management, for example. By typing in stroke, it will give us from within which specialties these calculators are available. And then we can select, sometimes it's a gender related calculator, so gender specific. So let's say I want to take the stroke risks in female patients. I'll then select this one. add in the information, and it will calculate it for me. From here also, we can use the most frequently used calculator, which is the body mass index calculators. Also, by typing in the abbreviation, it will select the appropriate calculators based on the specialties that they are available in. So when you select it, it will open the calculator. You can then change the units, as I'm doing right now, and add in the information. I'm going to exaggerate a little bit on this, and then it will automatically calculate it for us. It doesn't stop there because it also classified it for us to be able to interpret this calculator. Also, the formulary use and the reference use for these calculators are highlighted in there. Going back to the main page, on the content, we have additional features that are hidden in Uptodate. One of them is the What's New, which is a great section, allowing you to view all the updates of the previous 6 months, and they are segmented by specialty. So when you select the What's New, it will bring you to the What's New page. And from here, you can then select the specialty you want to view these updates from. So let's select, for example, infectious diseases. By selecting that infection diseases, it will give you the main page when the literature review was done and what the new topics are that has had an update, also written in a very short paragraph like a section, and also going directly to the topic itself. Another way of finding updates in Uptodate are the practice-changing updates, which are relatively different from the standard What's New. So let's say we have a pneumonia patient that used to be admitted at the hospital. Studies have shown that you don't need to admit them at the hospital, but you can prescribe a higher dosage of amoxicillin and treat them. They can recover from home. It requires for you, the physician, to follow up different and also approach in a different way. This information are being published in the practice changing update, so the grading of this information are also changed, and they are chronologically sorted. In this case, also by opening the practice changing updates, which you open the page, also allowing us to read when the last time the literature was reviewed and updated. And as you can see in primary care, there was an update in March regarding a certain medication, which will be listed in a very short paragraph like, but also the grading will be highlighted with the original topic in there. When you click on the original topic, it will open the new information as a pop-up. Excuse me for my voice. It will open the practice changing updates and the what's new information as a pop-up, so that there is by no chance you miss this information and read more about it. It will also go directly to the sections that has had this update. Sorry for that. For you to read more about those updates. From within the content, you also have the information or the option to go into more detailed drug information, whereby we have the general drug information, but also patient-related drug information. So when you are prescribing a drug, sometimes you need for the patient to know whether to take the drug during the meal or after the meal or before the meal, and why does this need to be taken that way. This information are also included. Also, what's new in drug therapy is a very relevant information, as they are being adding new drugs, treatments in order to do personalized medicine. But also, if there is a certain drug effect going on or side effects, this will be highlighted in this what's new drug therapy sections. I'll be going back to the content. We have a lot of patient-related information depending on the specialty. You can then select it from there, let's say for surgery, how does anesthesia works, all those kind of information are included in the patient-related information. As explained earlier on, we have the basic and the beyond basic information. Another great way of finding more information in Uptodate is searching by specialty. And you can do that by going under content and selecting the specialty. This specialty will allow you to go into the sub-specialty of the specialty you are looking into. So let's say we want to we are doing a study and want to find more information within the cardiovascular medicine, for example. We'll then select the cardiovascular medicine. It will give us all the subspecialties as we are viewing right now. Let's say we want to read more or see the section within the heart failure information. We can then select it, and then within the subspecialty, we can then select appropriate topics that we are interested in order to treat the patient. Please bear with me for another 1 minute, which is a great feature in Uptodate, which is the continuing medical education credit. For every topic viewed, it will accumulate a half AMA credit for you to use for accreditation purposes. And the Board of South Africa also recognized Uptodate as a clinical evidence-based tool to use at the points of care. So know that this information are included in the tool in order to use them. I hope this was insightful and helpful. Your trial will be starting on the 3rd of June. And in the meantime, if there are any questions in order in assessing the information or wherever that is, please do reach out to us via the email or through WhatsApp. We'll be more than happy to assist you with any information that you need at the point of care. I'll be putting my clinical or my contacts in the chat shortly so that you can always reach out to me. Thank you very much. Any questions? Tessa, would you like?
Yeah. Yeah, I just wanted to say thank you everyone for joining the meeting, the training. There will be a second session on Thursday if any of you would like to join again. But please do also remind your colleagues about the second session for them to attend. And then also just to let you know that I will be at Live Kingsbury next week. I will be setting up a little information station just to show you again how to register, and if there's any questions on how to navigate or access certain topics, I'll also be able to assist you. So I look forward to seeing all of you there next week. The second session will be a repeat. Yes, I see there's a question around whether the second session will be a repeat. Yes, it will be a repeat of the session. And then I'm also going to put the link for Uptodate on here. So you are welcome to also access it from now on already. The link should be active already. If you would like to just have a look and see.
Carrie Timmerman also asked a question. Can we register on our network? You need to register on the Live Healthcare network in order to have access to Uptodate. And this is a one-time requirement for the trial.
Yes, so after you've registered on Live Healthcare Network, you can download the app and then you can just enter your username and password on your mobile application, on your iPad, or on your phone, or on your own remote network.
Any other questions that we can
How
take?
do we into K8 into Kingsbury network? So any computer within the hospital, you will be able to access the Kingsbury network from any computer within the hospital.
Update Services, Stephen speaking. Are you going to give me a little bit of a rundown on how to assist the doctors to register?
Yes, we can do that. We can do that. Do you have some time later today? Then I can take you through it.
I
But
appreciate
also
it.
I will be there next week as well. But I can take you through it later today too.
Are any doctors going to be able to register before next week?
Yes, because the link is already active on your IP.
I
It has
see it.
already been opened.
I see it. So the moment you go to subscribe, it takes me to a different site. That's why I just need some assistance on showing me how on site
Yeah.
to assist a doctor if he has complications.
Yeah. Okay. Yes, we can do that. When do you have a opening?
Well, right after this meeting would be fine if you have a moment.
Okay. Yeah, that will
And
be
then it's
great.
done and dusted, because I know that my hospital manager is going to require me to be up to speed to assist. And I will have a doctor arrive at reception. And if I don't know how to assist them on the PC that I provided there, that's going to be embarrassing. I would like to have this under the belt now already.
Yes, no
Yeah.
problem. We can do that right after this meeting. I see there's another question regarding when I will be at Kingsbury next week. I'm going to finalize with Miss Malan what dates, but it would most probably be from Monday. Let me just have a look. So Monday is your first day that the Uptodate trial formally starts. So I will be there from Monday already. I'll probably come from around 10 a.m. and stay there till just after noon, maybe even longer, depending on how things go. But I'll probably be there from around 10 on Monday. And then I still have to discuss with Miss Milan where the information station will be set up, in which area of the hospital.
If I can
But
just
I have put
interrupt
my
you there.
contact number also there. Yes.
I have the information station. I have a station set up next to the vending machine in reception, where I'm going to be putting a Dell touchscreen for doctors to be able to use to subscribe and get on board.
Fantastic.
That is
Great.
already
Thank
set
you
up.
so much.
So just after this meeting, I'll put the PC out there for doctors to be able to subscribe. This is why I wanted to know how to assist them if they have trouble.
Okay. Awesome. Let's go through that now.
Thank you.
Any other questions? Stephen, there's a question asking whether the DAO will be available for the whole of next week.
Yes, it's going to be available for the whole of next week for onboarding. And I think we actually wanted to extend that to a second week, just in case we have some stragglers that were not able to take an opportunity to register.
Thank you, Stephen. And then another question asking whether you are able to also send your contact details, Stephen. Gary Timmerman has asked whether they can also get your contact details.
Absolutely, as all the doctors on site have access to my details. Do you want me to post that here on this site? It's best to WhatsApp me on the cell phone just to make an arrangement.
Yeah, maybe put it in the chat.
On the chat, let's do that.
Okay, any other questions? I think if there's no other questions, then we can close the meeting, and then I'll see you all next week.
Thank you so much, and good luck with the trial.
Okay.
Bye bye.